All right, let me show you what I have open here. So this is the appendicular skeleton slides. Then I have the lab diagrams, okay, which we've already kind of filled out for axial. We've kind of already done this part of it, but we're going to fill out the rest of it. And then I also have Arthur hanging out with us today, okay? Let's do it. So today we have the appendicular skeleton. If you remember last time we learned the axioskeleton, that was the skull, spine, and rib cage. Today we're doing appendicular, which is appendages, meaning the upper extremity, like the shoulder, arms, and hand, and the lower extremity, the hip, legs, and feet. So when we learn the appendicular skeleton, we go top down, all right? So the first place we're going to start is called the pectoral girdle, okay? And this is what makes up your shoulder, okay? It's going to be made up of the clavicle, scapula, and humerus, which is the collarbone, the shoulder blade, and the upper arm bone. Okay, so let's learn the bones of the pectoral girdle. Okay, this is the area that stabilizes your shoulder. The first bone is the clavicle. Okay, the clavicle is the collarbone. Okay, but from now on, we're not going to say collarbone, we're going to say clavicle. And that is right up front here. All right, it is this S-shaped bone. Okay, and it actually connects the axial skeleton to the appendicular skeleton. All right, so let's take a look at it on Arthur. Again, this app is free for bones. So if you haven't downloaded it already, it's pretty fun. I like using it. And it's even really cool to use like in front of your friends on your phone. Most people really like looking at this stuff. So it's called Complete Anatomy 2021. Here's the clavicle. Okay, you can notice on the medial side of it, it actually articulates or makes a joint with this bone. What bone is this?
Manubrium.
Very good. The manubrium is the specific part of the bone, and the whole bone itself is called what?
Sternum.
Very good, sternum. Okay, so the manubrium of the sternum actually connects here to the clavicle. Now, this looks like it's just floating. Just keep in mind, I don't have connective tissue turned on. So if I turn on connective tissue, you'll see that there's a ligament connecting it like that, okay? So there's the manubrium of the sternum connecting to the clavicle. And if you follow the clavicle all the way to the distal end of it, you'll see that it's actually connecting here to the shoulder blade. We'll learn this bone in a second. That's the scapula here. Okay. So the clavicle is actually attaching the axial skeleton to the appendicular skeleton. We don't have a picture of the clavicle on the lab diagrams because there's no specific structures, okay? So if you see this on the quiz, you just need to know that it's the clavicle. The next bone is the shoulder blade, okay? From now on, we're just gonna say scapula. The first thing we need to do is orient ourselves on the front and back parts of it, okay? The way I do that is I look at this diagonal piece right here. You see this big diagonal piece? Okay, one side has this big diagonal piece, the other side doesn't have that. The big diagonal piece, which is called the spine, is on the back side of it. So that's how you know if you're looking at the front or back. Okay, so like if we look at Arthur, okay, you see that that big diagonal piece is on the back side. That's how you know you're looking at the posterior side of the scapula. So let's name some of those structures. Okay, so that diagonal structure is called the spine of the scapula. And if you follow it all the way to the tip, this is going to be a very important structure called the acromion or the acromion process. Okay, this is actually going to make a joint with the clavicle. Let's look at it on Arthur. So here's the spine. And then here's the acromion. See how the acromion is making a joint here with the clavicle. You guys ever heard of an AC joint? Okay, maybe if you played football or some other contact sports, you would hear about the AC joint. This is commonly dislocated in football because the guys are tackling with their shoulders, right? So this joint right here commonly gets dislocated, and it's called the Acromioclavicular Joint or AC joint, right? And it's named properly: acromion of the scapula and the clavicle, acromioclavicular joint. All right, so let's draw those in. Mark up. Okay, so here is the spine. Here is the acromion. Next slide. Here is the actual socket for the arm. You know how the arm has a ball on the top, right? It's a ball and socket. It fits into a socket. This is the socket. If you look at the scapula from the lateral angle, from the side, you see this circle indentation. Okay. And remember, anything that's like indented like that, right? Like a cave is called a fossa. We had some on the skull. Okay. So this is the glenoid fossa, which is the socket for the arm. And it's on the lateral aspect of the scapula. So on Arthur, you can see the ball of the arm is fitting into this socket here. This socket is called the glenoid fossa. Okay, and notice how it's on the scapula, right? The arm is attaching to the scapula. So it's like one bone connects to another bone, which supports another bone. Okay. So the humerus of the arm is connecting to the glenoid fossa, sometimes called the glenoid cavity. Let's draw it right here. Let me know if I'm moving too fast. All right, next we have a few more fossas. Okay, remember a fossa is an indentation. Okay, so these ones are actually not too bad if you just break the word down. Okay, what does supraspinous sound like? What is supra, first off? What does supra sound like?
On top.
Superior.
Oh, superior.
Superior, right? Superior, like above. And infra sounds like what?
Inside.
Inferior. Do you guys?
Inferior.
Yeah, inferior. So you have superior, which meant above, inferior, which meant below. And spinous refers to this piece here, what was the diagonal piece called?
The spine.
The spine, okay? So supraspinous means superior to the spine, and infraspinous means inferior to the spine, Okay, so there's two fossas here, and these are going to be actually areas where the rotator cuff muscles sit. Okay, so if we look at it on Arthur, you can actually see why it's a good place for a muscle to sit. Here's the supraspinous fossa, and below it is the infraspinous fossa. Actually, if I were to add my muscles here, this is one feature you have to pay for, which I paid $35 for a year, which is not too bad. See how the muscles sit in those fossas? These are your rotator cuff muscles sitting in those fossas. And thankfully, they're named just like the fossas are. Supraspinatus muscle, infraspinatus muscle. We'll learn all about this in a few weeks. Supraspinous fossa, infraspinous fossa. Oh, good boy. Hey, you good boy. What, you hungry? You got food? All right, now let's flip the scapula to the front side, okay? Remember, the front side didn't have that big diagonal piece, okay? So now we're at the anterior view of the scapula, which is kind of between the scapula and the ribs, okay? If you look at it from the front side, you'll see like the front side of the scapula is like in contact with the ribs, okay? There's two structures here. First off is the subscapular fossa. Okay, so we had the supraspinous, infraspinous fossa on the posterior side. Now the subscapular fossa on the anterior side. And subscapular means under the scapula, like submarine, under, right? Subscapular means under scapular fossa. Okay. And then another structure is going to be this piece of bone that sticks out. Often people confuse this with the acromion. It is not the acromion. This is the coracoid process. It sticks out a little more anteriorly. So if we look at it on Arthur, okay, make sure you can tell the difference between the acromion, which is up here, and the coracoid process here. Okay. The coracoid process is really cool because the biceps muscle is actually going to attach right here. Okay, one of the biceps tendons, it starts right here. I can show you. See that? Starting at that coracoid process. All right, what was this fossa called? It's like hangman.
Supra?
No, that was over here. This one was under scapula.
Subscapular fossa.
Very good. Subscapular fossa. Okay, so we have three fossas: supraspinous, infraspinous fossas on the back side, subscapular fossa on the front side, or on the anterior side. And this process right here, what was this called?
Acromion.
No. Remember, don't confuse the acromion on the back side with this process on the front side.
Coracoid?
Very good. Coracoid. I know that's tricky. Okay, so first thing to do is, are you looking at the front side or are you looking at the back side? If you're looking at the front, you're going to see the coracoid process better. If you're looking at the back, you're going to see the acromion better. Okay, again, if we go to Arthur, you can see here is the acromion, here is the coracoid. Oh, and then also, you do need to know, this is pretty easy, but you do need to know the borders, okay? So the scapula is kind of like a triangle shape, so it's going to have 3 borders. It's going to have this border here, which is the lateral border. It's going to have this border here, which is the medial border, and this border here, which is the superior border. Okay, just always remember that the glenoid, the socket, is on the lateral side, okay? Because that's where the ball has to attach, to the lateral side of the scapula. All right, first arm bone is the humerus. Okay, why is it named that? What does that remind you of?
Funny bone.
Very good, the funny bone. There's actually a piece of your tissue right here where there's the ulnar nerve is exposed. It's not protected very well. Okay, and hitting this gives you those tingling sensations, which is not very funny at all, right? But maybe that's a good way to remember this bone. Yeah, it has a terrible sense of humor, right? So this is the humerus, all right? Here's an anterior view of it. Now, when you're looking at the humerus, you got to be able to tell if you're looking at the front or the back as well. And the best way to do that is to find this groove. It's called the Intertubercular Groove, okay? If you were looking at it without the label, you would see this little divot, okay, this dark area right here. This is the intertubercular groove. And the intertubercular groove is an area where the other head of the biceps tendon sits inside of this groove. Okay, actually, if anyone has shoulder pain right up front right here, okay, you could have what's called bicipital tendonitis, where the tendon from the biceps is coming up and it's getting inflamed right inside of that groove there. Okay, if I show it to you on Arthur, you'll see it right here. You see this groove? Okay, actually, I'll show you that tendon. See that biceps tendon there? It's sitting right inside that groove. Pretty cool, huh? That is called the intertubercular groove. And the reason it's called that, intertubercular, meaning it's between 2 tubercles. Okay, you have a greater tubercle and a lesser tubercle. And these tubercles are places where the rotator cuff muscles are going to attach. Remember the supraspinous fossa, infraspinous fossa? Those were the rotator cuffs. They're actually going to come and attach to these places. All you really need to know is that these tubercles are sites for muscle attachment. Okay, and the greater tubercle is going to be on the lateral side. Okay, notice you have the head, which is kind of angled inwards. You're going to have 2 tubercles on either side of the intertubercular groove. So let's look on Arthur here. Looking at the ball and socket of the shoulder here. Okay, here is your head. Okay, who remembers what the head is sitting inside of? What is this structure here? What is this socket?
Glenoid Fossa.
Very good. Glenoid fossa of the scapula. So that's the head. And then you're going to have these two tubercles. Now, the bigger one, see this one's way bigger, is the greater tubercle. And then you have the lesser tubercle closer to the head. Okay. So the greater tubercle is on the opposite side of the head. And in between the greater and lesser tubercles is the intertubercular groove, which is where the tendon sits. So this is the head. Okay. Then here you have the intertubercular groove. And then who can tell me the two tubercles? Which one is this?
Lesser.
Very good. Lesser tubercle. And greater tubercle. So the pictures on your quiz and exam will be more like this, okay? It'll be more of a picture of a real bone, and it will be colored like this, okay? So these are the good pictures to study. Okay, and also the practice exercise; those have good pictures too. So that was closer to the shoulder. Now let's go down to the bottom of the humerus, which is closer to the elbow. Here's the distal end of the humerus, and there's 4 main structures we need to learn here. First thing I want you to do is look at these epicondyles. There's going to be a lateral and medial epicondyle. Feel your elbow in anatomical position with the palm facing forward. Feel the inside of your elbow and feel the outside of your elbow. Which side is bonier, medial or lateral?
What was the question?
So I asked, if you feel your elbow in anatomical position, which side is like a bonier bump, the medial side or the lateral side?
Medial?
Medial, right? You got this big bump right here, right? You can feel that bony part. That is the medial epicondyle, okay? Medial epicondyle is much more prominent. You see how it's sticking out like that. The lateral side does have an epicondyle as well, okay? And these are sites for muscle attachment as well, muscles that move the arm and wrist, or the wrist and fingers. Actually, if you feel your medial epicondyle, that bump, just a little distal to it, and then flex your wrist like this, like flex and relax, you can feel the muscles contracting from that point right there. Okay, this is where you get like golfer's elbow. People with golfer's elbow have problems here, whereas the lateral side is more like tennis elbow. Okay, so you get muscles from the forearm that are attaching at these epicondyles. Okay, and then you're going to have the actual parts of the elbow joint that sit inside the joint, which is the trochlea and the capitulum. Okay, and this will make more sense in a second. There's 2 bones in your forearm, and those 2 bones are going to attach at these locations. One of them is going to attach to the trochlea, one of them is going to attach to the capitulum. Okay, but for now, let's just focus on the epicondyles. Gosh, why is my screen not moving there? Okay, so here is the medial epicondyle. Here is the lateral. Okay, and then we're going to have those two structures inside. One of them is called the capitulum. The other one's called the trochlea. I'll cover those more in detail in just a second. Okay. If we go on Arthur here, you'll see how there's two bones in the forearm, right? One of them is going to attach to the capitulum. The other one's going to attach to the trochlea. Let's talk about these two bones. First one is radius, okay? Radius, all you need to know is the head of the radius, okay? The head of the radius, it has this like round part at the top, and it's going to attach to the capitulum, okay? So the head of the radius is attaching to the capitulum, okay? So if you look at it on Arthur, here's the radius. And the head of the radius, you see how it's this round portion here? It's attaching to the capitulum of the humerus. This joint right here, what it allows you to do is supination and pronation or rotation of your forearm. Okay. And the cool thing is radius, no matter what motion you make, radius is always on the lateral side. It's always going to be on the thumb side. Okay. So radius is the lateral bone of the forearm. Okay. It's always going to follow on the thumb side. And in anatomical position, it is the lateral bone. And it's attaching to the capitulum of the humerus. Okay. Capitulum in Latin means bald head. Okay. So radius is actually attaching to this part. So here's the radius and here's the radial head. Okay. Very important to know that radius allows for supination and pronation, which are ways to describe this motion, turning your wrist like this. Okay. The other bone of the forearm is going to be the ulna. The ulna. And the ulna has this like, it reminds me of like a baby dinosaur with his mouth open. Okay. You see the dinosaur here with his mouth open. This is the ulna. Okay. An ulna is going to have a couple structures you need to know, 3 structures. Well, before we talk about these structures, I want to show you ulna on Arthur. Notice how ulna is actually the part making the elbow, the tip of your elbow. So when you feel the tip of your elbow, this is actually ulna that you're feeling. Okay, it is this part right here, and it's kind of that little C, that dinosaur head. The mouth is wrapping around the humerus, or more specifically, the trochlea of the humerus. Okay. Remember, the trochlea was this part here. Okay. So the ulna, that C shape is wrapping around the trochlea. And what that's allowing for is flexion and extension of the forearm. Okay. So whereas radius was letting you supinate and pronate or rotate like this, ulna is allowing for flexion and extension of the elbow. Okay, so these two bones serve different purposes at that joint level. So the inside of the C is called the trochlear notch, which makes sense, right? Because the trochlear notch is rotating around the trochlea of the humerus. And then the tip of the elbow, okay, or the top of the dinosaur's mouth is called the olecranon. The bottom of the ulna is called the head. Okay, this is counterintuitive. We just got to remember that. Okay, so here we have ulna. Here is the olecranon. Here is the trochlear notch. Here is the ulnar head. You can actually feel the ulnar head if you feel your wrist on the pinky side, but in the wrist, there's a big bump right here. You guys feel this bump right here? This bump is the ulnar head, more specifically the ulnar styloid process, but you don't need to know that. Okay. This bump is the feeling of your ulnar head. And just like radius was always going to be on the lateral side of the thumb side, the ulna is always going to be pinky side. Okay. So it's always the medial bone in the forearm. Okay. So try to remember that. Ulna is the medial bone in the forearm. Radius is the lateral bone in the forearm. All right. And see how ulna and radius actually connect to the wrist bones. Who remembers what the wrist region is called?
Carpal.
Very good. The wrist bones are the carpals. Okay. And there are 8 carpals. 8 carpals. Okay. Now you don't need to know where each of them are because that's pretty challenging, but you do need to know their names. Okay. And this PowerPoint doesn't have them listed in here. This is something you should use your lab notes for. So if we go to the lab notes, here's the lab notes that you should be studying. This won't be like an identification question. Okay. That means it won't be like a fill in the blank, but it might ask you about the 8 carpal bones. Okay. Which are scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. Now, it won't ask you to label them, but it might say something like, which of the following are carpals? Okay. And you'd have to select which ones are. Now, the mnemonic I use for this is Sally left the party. Who watched my video that I posted? Can anyone finish this mnemonic?
Yes, I can.
Do it.
To take Charlie home.
Nice. Very good. To take Charlie home. Who is that, by the way? What's your name?
It's me, Ashley.
Ashley. Awesome. Okay. So this is the mnemonic I use to remember these 8 bones: scaphoid, lunate, triquetrum, pisiform. Sally left the party. Okay. To take Charlie home. Trapezium, trapezoid, capitate, hamate. Okay. Again, you don't need to know where they are exactly. You just need to know the names of them. Okay. Sally left the party to take Charlie home. All right. So there's 8 carpals. Now we have the metacarpals. The metacarpals are the bones in the hand. Okay. A lot of students get confused. They think these are your fingers. No, these are not. These are your hand bones. If you feel inside your hand, you have long bones in here, right? These are the metacarpals. Okay. And there are 5 of them. And you're always going to label starting from the thumb. So you have metacarpal 1, metacarpal 2, 3, 4, and 5. Okay, so if I were to give you a question that was like, you know, what is this bone here? You would write second metacarpal or metacarpal 2. Okay. And then the last bones, oops, sorry. Okay, so here are the metacarpals. And here are the fingers, okay? We call them phalanges. Now, each finger is gonna have several phalanges, okay? And the way we name them are whether they're in the proximal row, the middle row, or the distal row, okay? So see how, okay, these were the metacarpals, right? So we're gonna kind of draw, this is where the hand would end. Okay, and then this is the fingers down here. Okay, so I drew a circle around the hand, but we got the fingers down here. And each of the fingers has 3 bones, except for the thumb. The thumb only has 2. Okay, and the first row here is the proximal row. Then you have a middle row, and then a distal row. Okay, so you're gonna have a proximal phalanx, a middle phalanx, and a distal phalanx, whereas the thumb only has a proximal and a distal phalanx. Okay, so if I were to ask you a question about this bone right here, the answer would be second middle phalanx. Okay, and that's because remember, we just like the metacarpals, we're going to number it from the thumb. Okay, so this is the second finger. And because we're pointing at the middle row, we're going to say middle phalanx. By the way, phalanx is singular. Phalanges is plural. Okay, so this, if you're talking about just one, you would say phalanx. Okay, let's do a little test. Who can tell me the name of this bone here?
Distal.
The full name of it. It is distal. How would I describe this entire bone though?
The first distal phalanx.
Very good. First distal phalanx. Okay. How about this one here?
Fourth metacarpal phalanx.
Close. Fourth middle phalanx. Okay. What was a metacarpal?
The wrist.
No, the wrist was carpals.
Oh,
So metacarpals is the hand. Okay. Metacarpals are the hand bones. So we had carpals in the wrist, metacarpals in the hand, and phalanges or phalanx in the fingers. Okay. So this is the fourth middle phalanx. Okay. Because we have the proximal one here and the distal one here. All right. Let's do another one. What is this one here?
the 5th proximal.
Phalanx.
Very good. Fifth proximal phalanx. So, I know this is not a math class, but who can tell me how many phalanges are in one hand?
Wait, mister, I have a question.
Yeah.
Can you, I wish I could show you what I'm pointing at. You know the red part that you have highlighting?
Mhm.
That part, what is that one called? Proximal or distal?
Proximal.
And then the blue
Proximal.
one is the middle one?
Middle.
And then the green
Yeah.
one?
So there's the proximal row,
Mhm.
the middle row, and the distal row. Remember, distal means farther.
Yep.
Okay, remember the furthest point is distal. Okay, proximal is closer to the point of origin, closer up. Okay, so we're gonna have this proximal row. Here, I'll draw the proximal row.
Mhm.
Here's the proximal row. Okay, then you're gonna have the middle row. And then the distal row. Okay, and remember the thumb has a distal one as well.
Okay. Okay. Okay, thank you.
Mhm. Who knows how many phalanges are in one hand?
Would be 14.
14, very good, right? Because there's 3 in each finger, okay? And then 2 in the thumb. So 3, 6, 9, 12, 13, 14. What would you say if I told you to name this bone here?
The third metacarpal.
Very good. Third metacarpal. Okay. Here again are the bones of the wrist. You don't know where, we need to know where they all are. You just need to know the name. Like here's scaphoid and lunate, triquetrum. Okay. All right, let's do a Kahoot. And then we'll take a break. They're always trying to sell me on the pro version.
Because you're a pro.
Maybe. That would explain it. Come on. All right. So this is going to have multiple choice questions, but remember that your quiz isn't multiple choice. So if you want to challenge yourself, what you can do is try taking out a piece of paper and writing down the name of the bone without looking at the choices. Okay. Now I know we're still learning it and it might be too early to try that. That's fine. But if you already watched my video and you're trying to kind of just hammer it in there, it might be a good way to practice. All right, here we go. See if you can name it without looking at the choices. Very good. That is the clavicle. Okay, that is the clavicle. We haven't learned the femur yet. We will soon, though. Okay, remember the clavicle attaches the sternum to the scapula, the collarbone. Very good. That is the scapula. That is the shoulder blade. Who can tell me, are we looking at the anterior or posterior side of it right now?
Posterior.
Very good. Posterior. And how do you know that? Because of this diagonal part. Diagonal piece means it's the back of it. Do you remember what that diagonal piece is called?
Fine.
Very good. How about this? How about A? Nice job. That is the acromion. Remember, the acromion is the when you follow the spine all the way to the tip, okay, the acromion actually articulates, makes a joint with the clavicle called the AC joint or acromioclavicular joint. Nice job. That's the upper arm bone, the humerus. What is the bone on the right? Crushing it, guys. Crushing it. Okay, remember the medial bone of the forearm is the ulna. Okay, is the ulna going to be the pinky side or the thumb side?
The pinky side.
Very good. The ulna is always going to be on the pinky side, right? Which is the medial side. Nice job. Those are the carpals. Okay, be sure you can name the carpals. Remember, Sally left the party to take Charlie home. Scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, hamate. I feel like I should write a song about that.
Let us know if you do.
Let me know if you do. I'll use it forever. What is B? Good. That diagonal piece is the spine. What is it? It's hard to see, but it's the little cavity right there, the socket. Nice job, guys. That is the glenoid cavity. That is the socket for the humerus head to fit into. Very good. The humeral head. All right. There was some more things on the scapula you should remember. Okay. So make sure you know like the fossas. Okay, subscapular, supraspinous, infraspinous. Okay. Make sure you get those down. Make sure you know the borders. Okay. I can't Kahoot you on every single thing you need to know, but yeah, make sure you study those as well. Okay. That was the humeral head. Nice job. So that's the greater tubercle, okay, which is on the opposite side of the head. And then the lesser tubercle is closer to the head, where in the groove, you can find the groove right in the middle. It's called the Inter-Tubercular Groove. Okay, remember that is the place for muscle attachment, specifically the rotator cuffs. Oh, well, we didn't learn that. Okay. It's called the Olecranon fossa, and that's because the olecranon of the ulna is going to fit into that part. Sorry to ruin your streaks. You guys are rock stars. Okay, so that is the trochlea. Okay, remember the trochlea is where the ulna attaches. Who remembers what this one's called?
Capitulum.
Lateral.
Very good. Capitulum. Okay, the lateral epicondyle is this bump here, but this is the capitulum where the radius is going to attach. Good job. I guess I didn't ruin your answer streaks. Nice. Very good, very good. That is the lateral epicondyle. Okay. So the epicondyles are the bumps on either side. Remember, the medial one is way bumpier on your medial elbow. Okay. And if you can't tell the difference between medial and lateral, I usually look at the head. See, the head is angled. Okay. The head's always going to angle medially, right? Because it needs to angle into the body. So the head is always going to be on the medial side. So that's going to be the medial epicondyle. Lateral epicondyle would be over here.
Oh,
Very good. Radius. On the thumb side. Lateral side.
it was a
Oh, sorry. Oops. Sorry, I didn't mean to skip that. Remember the top of the C? Remember the dinosaur mouth? The top of the C is the olecranon. I think I gotta skip the next one. Make sure you mute yourself if you're not asking any questions. I can feel someone's breathing. Oh, yeah, you don't know styloid process. What is D? Oh, you don't know that one either. Sorry, guys. All right, here's the hand. What are the arrows pointing at? Very good. Okay, how about if I asked you more specifically, what is this one called?
The distal phalange. Blue one.
First distal
Oh.
phalange.
Okay, so you don't want to say phalange if you're just talking about one. What do you want to say if you're just talking about one singular one?
Phalanx.
Good, phalanx. Okay, so this is the first. Okay, make sure you're specific. First distal phalanx. Okay. What about this one?
The fifth proximal phalanx.
Very good. Fifth proximal phalanx. Okay, how about this one?
The third medial.
Right, third middle phalanx, right? Yeah. Okay. Is there a first middle phalanx?
No.
No, right? No first middle row. Okay, make sure you get this down. And if you need to stay after to ask me questions on it, you can. Okay. But the quiz will ask you questions just like this. Last one, I'm gonna take a break. Good. What specifically, though, if I asked you on the quiz, which bone is this? You would say what specifically?
The fourth metacarpal?
Very good. Fourth metacarpal. Remember, we start at the thumb. Okay. So this is the first metacarpal, second, third, fourth, and fifth. Fourth metacarpal. All right. Go ahead and take a 5-minute break. I'll see you back here at 11:09. Or I'll just make it 11:10. Sorry, I forgot to label this one. Okay, so make sure you know how many of each of these there are. 8 carpals, 5 metacarpals, 14 phalanges. Okay, make sure you can name each singular phalanx as well. Here are some good views of the elbow. Who can tell me what bone this is?
The
Me, Ulna.
Very good, ulna. And what is this point right here called?
Olecranon.
Very good. Thanks for pronouncing it correctly too. Some people say olecranon. Olecranon. Olecranon is correct. All right. Any questions before we move forward? We're going to go down to the lower extremity now, the pelvis. Just so we are not confused, the trochlear notch is this part right here that you see like in gray. Okay. The trochlear notch is the inside of the dinosaur's mouth. All right. Just like we had a pectoral girdle, now we're going to have a pelvic girdle in the pelvis, okay? Like the pectoral girdle had the clavicle and the scapula. The pelvic girdle is going to have what's called the coxa. And the coxa is connecting to the axioskeleton because we already learned about the sacrum, right? So you can see that there's a left and right coxa, and it's connecting to the sacrum. So this bone here is called the coxa, but the coxa is actually made up of 3 bones that are fused together. So if we look at the 3 bones of the coxa, these are them. So we have ilium on top, we have ischium on the backside, and pubis in the front, like pubic region, right? So you can see that on this picture is really good. The ilium is this top part here, and the ilium, you can feel the top of your hip, right? The ilium is where your love handles are. My ilium is very high, and it gives me like very like high love handles, which I'm very self-conscious about. Okay, we got the ilium on top, then we have this part right up front that makes the pubis bone. Okay, we call it the pointy pubis. Notice how it's kind of pointy. Okay, when you bring them together, left and right pubis, you get the pubic region. And then the butt bones is called the ischium, more rounded. Okay, so if you see a round part, it's the ischium. Okay, like if you see someone at a party and you want to compliment their butt, tell them they got a nice ischium. Hey, that's a nice ischium you got. All right, so the ischium is the butt bone, the pubis is the pubic bone, and the ilium is the top of the pelvis. Okay. So let's see on Arthur. Okay, the coxa is kind of hard to wrap your head around because you really need it to be 3D. Those two-dimensional pictures don't help very much. So here's the ilium. Notice how it's making a joint with the sacrum. It's called the SI joint. The chiropractor usually adjusts this region right here. So that's the top of the coxa, the ilium. Okay. What is this one up front?
Is it the pubic?
Very good. This is the pubis. Okay. And left and right pubis come together to make the pubic bone. And then we get the butt bones, these round portions. What was this called? Ischium, right? This is the ischium. So a few things you should know about this. The ilium is going to be where muscles attach that support the spine, and even that muscles that go all the way to the arm, like the latissimus dorsi. Okay, so just know that it's a muscle attachment spot for muscles that support the spine, whereas the ischium is going to be a muscle attachment spot for the hamstrings that move the leg. Okay, so the hamstrings are actually going to start here on the ischium. So let's draw these in. Okay, first off, this entire thing is called the coxa. Okay, but let's label each specific one. So here we have the ilium. Okay, this pointed bone is the pubis. You can also see it here. And then what was this one called?
Ischium.
Very good, ischium. There's a few structures we have to label on these coxa bone. Okay, first off, let's start with the iliac crest. Okay, so this whole bone is the ilium, but the entire top arch is the iliac crest. Okay. If you follow that iliac crest down, you're going to find this little notch right here called the greater sciatic notch. This is where the sciatic nerve passes through. Have you ever heard grandma complain about her sciatica, right? The pain that runs down her butt into her legs? That's the sciatic nerve running through that sciatic knots. I'm reading the chat. That's funny. Okay, so that's the greater sciatic notch. And then we have this big circle right here. It's the crater. Look at this crater right here. This is going to be the socket for the hip. Okay, we call this the acetabulum. This is my favorite bone structure, the acetabulum. Okay, so let's look at some of these structures on Arthur. Okay, first you're going to have that arch right here called the iliac crest. Then you're going to have this notch right here called the greater sciatic notch. And lastly is the acetabulum. Let me hide this femur. You see this big crater? Almost like a meteor hit it, right? We call this the acetabulum. And the femur sits right inside of it. Okay. So here is the iliac crest. Okay. Here is the greater sciatic notch. Okay, and who remembers what this big crater was called? No one? Acetabulum. Acetabulum. Okay, this is the socket for the femur. Who remembers what the socket for the shoulder was called? What was the socket that the arm bone fit into?
The glenoid fossa.
Very good. Glenoid fossa. Glenoid fossa. Okay, so in the femur, it's the acetabulum. Oh, man. I used the wrong pen. Let me fix that. There we go. Okay, two more structures we need to know, which is the obturator foramen. Remember, foramen means hole. Okay, the obturator foramen, actually, it nothing goes through here. It's covered by a sheet of connective tissue. But the point of the obturator foramen is to make this coxa bone lighter. Okay, because if it was filled with bone here, it'd be very heavy. So there's a hole here that allows it to stay strong still, but makes it lighter. Okay, so that's the obturator foramen. And then we have the ischial tuberosity, which is pretty much just the part of the ischium where the muscle attachments are going to be. Remember, I said the hamstrings attached to the ischium. So the ischial tuberosity is this specific exposed part of it where muscle attachments are. Okay, remember the entire ischium is here in orange. Okay, but just this outer part of it is where the muscles attach. We call that the ischial tuberosity. Okay, so if you see, here's the obturator foramen, this hole. Okay, and then the ischial tuberosity is just this part where muscles will attach. I'll show you. Okay, here are the hamstrings. See how they're attaching to this ischial tuberosity, which is just the edge of that ischium. Look how complicated the muscles are. It's crazy. Okay, what was this called? Obturator foramen. Feel like I'm losing you guys. All right, and then we have the ischial tuberosity. Cool. Last part of the coxa we need to know is the pubic symphysis. Pubic symphysis. So the part where the two pubic bones come together, there's going to be this pad of cartilage in between them, which is a joint called the pubic symphysis. And one cool thing about this pubic symphysis, is anyone interested in forensics? If you are, this is kind of fun because the pubic symphysis is something you'd look at. Let's say, just for fun, you were to come upon a buried body, okay? A body that's been dead for a long time, decomposed, and you can't get any DNA from it, but you have the skeleton, and you want to determine if that skeleton is a male or female. How are you going to do it? Well, this is the one way you determine it, and that's called the sub-pubic angle, okay? The sub-pubic angle, you look at this angle, and if this angle is less than 90, it's going to be a male, okay? And if it's greater than 90, it's a female. Why is that? Why do you think that is?
They need more room to give birth to
Yeah,
kids.
right. It's for the birth canal, right? The larger the angle, the more area you have for that birth canal. Like a male's pelvis will never be able to support a live birth. Okay, so if we look at like for example this skeleton, and we look at that sub-pubic angle, which is right here. Would you say this is a male or a female?
Male.
Very good. Male, right? This is definitely less than 90. All right. You won't be tested on this, but it's a fun, interesting fact. Okay, so this would not be a large enough birth canal. All right, we got the femur. The femur, the longest bone in the body. Very, very painful to break. Very difficult to break too. Okay, so if you break your femur, that's some pretty significant trauma, most likely a big fall injury. Okay, the femur has these structures on the proximal end of it. Okay, so just like the humerus, it's going to have a head and a neck. Okay, so here's the head, here's the neck. By the way, lots of students for some reason confuse the femur with the humerus. Okay, the humerus doesn't have these two big bumps on the top. Okay, the humerus just has one large head. Okay, whereas the femur, the way I can tell is you got the head, and then you got this, this other kind of ugly head next to it. That's how you tell that it's the femur and not the humerus. Okay, so here's the head, here's the neck, and then we're going to have what are called trochanters. If you remember with the humerus, we had tubercles, greater tubercle and lesser tubercle. The femur has the same thing actually, except they're not tubercles, they are trochanters. Okay, but just like the humerus, the trochanter, the greater one is on the lateral side, the lesser one is on the medial side. And these are sites for muscle attachments as well, specifically the glute muscles, okay, the butt muscles. So here's the head, the neck, the greater trochanter, and the lesser trochanter. So here's the femur. You have the head going into the acetabulum, then the neck, and the greater trochanter here, this big bump. This whole thing is the greater trochanter. And then this bump on the medial side is the lesser trochanter. Right? Those are muscle attachment sites. Cool. Just like the humerus, the greater one is on the lateral side, the lesser one's on the medial side. But in the humerus, they weren't called trochanters, they were called tubercles. And the distal end of the femur looks like this, okay? Just like the humerus as well, we're gonna have medial and lateral epicondyles on the sides, okay? And then we're gonna have just regular condyles on the bottom, okay? The condyles are what actually hold all the weight. They make the knee joint. Whereas the epicondyles, nothing is like sitting on top of the epicondyle. It's just a place for ligament and muscle attachment. Okay. So if I were to look at on Arthur and go down to the bottom where the knee is, I love the knee. It's such a cool joint. Okay. Let's go to the back of it. Okay. You'll see how the condyles are actually holding the weight, whereas the epicondyles are just the sides. Okay. So the condyles are down here. The epicondyles are on the sides. Okay. And then in between the condyles is the intercondylar fossa.
Question. So when someone gets like a knee replacement, is it just the patella bone that they're replacing?
No, they replace this entire bottom part. They literally just cut this off, like a full knee replacement. They're cutting this off and replacing this whole bottom portion. Sometimes you do a partial knee replacement. They just cut one of them and replace this part. Because this is where the cartilage is, and this is the cartilage that's been degenerated. So they need to replace it with something else because it's bone on bone. Okay, there's no cartilage left. So they need to replace the condyles of the femur. Good question.
Thank you.
Okay, so be able to tell which one's the medial and lateral side. Again, if you need help with determining that, look at the head. Okay, the head is always going to be medial. So this is going to be the medial side over here. So we'll have the medial. What is this? The medial what?
Epicondyle.
Very good. Epicondyle. And this would be the what?
Medial condyle.
Medial condyle. Ah, crap. Wrong pen again. And then we'll have the lateral ones. Okay, and in between the condyles is the intercondylar fossa. All right. Right in front of the femur on the distal end will be the patella. The patella sits right at the end of the femur. Okay. And it actually, what it's going to do is it's going to attach ligaments and muscles. Okay. So it's not like actually connected, right? You gotta add some ligaments in order to connect it to the bone. Okay. But it'll be a muscle attachment site. Okay. For the knee. Like if I add some muscles here, you'll see. See how the quadriceps muscle pretty much like encircles the whole patella. Okay. And then the patella connects down here to the tibia. Okay, so the tibia will be the biggest bone in the lower leg. This is where the femur is going to attach. And the tibia actually has condyles as well, just like the femur. So the femur condyles and the tibial condyles will come in contact like this. So the tibia is holding all the weight, okay? Whereas the fibula, you'll see in a second, the fibula is the smaller bone in the low leg. The fibula is not holding any weight, okay? The tibia is holding all the weight of the femur, okay? And the tibia has medial and lateral condyles as well, okay? So we have the medial and lateral condyles of the tibia, and then we're going to have this big bump in the front. Remember when we saw the patella attaching to the tibia with these ligaments? Those ligaments are attaching to the tibial tuberosity. Okay. So here's the medial condyle of the tibia, and then the lateral condyle of the tibia. The way I tell this is the fibula is going to be the lateral bone in the leg. So the medial condyle will be on the opposite side of that. Okay. So the condyles are holding all the weight of the femur. And then we have this bump right up in the front called the tibial tuberosity. Okay, and this is a site of ligament and muscle attachment. If you go to the bottom of the tibia, you're going to find one structure you need to know here, and that is the medial malleolus. Feel your ankle. Feel the inside of your ankle. Okay, feel that big bump on your ankle. You can't miss it. That big bump in the inside of your ankle is the tibia. It's called the medial malleolus. Okay, the bump on the outside of your ankle is not the tibia. Okay, that's going to be the fibula. We'll get there in a second. But the medial side is the medial malleolus. Okay, here we have the fibula. The only thing you need to know about fibula is the bump here called the lateral malleolus. Okay, also please don't mix these names up. Okay, I have students that will sometimes say fibia and tibula. Okay, please remember that it's fibula and tibia. Okay, the fibula is the lateral bone in the lower leg. The tibia is the medial bone. The fibula goes all the way down and makes the outer bump of your ankle called the lateral malleolus. You can see here. Almost done. Okay, so the carpals were the wrist bones. The tarsals are going to be the ankle bones. And the two most important ones are calcaneus and talus. Look at this picture here. Okay, you got talus on top. Talus is actually connecting to tibia and fibula from above, whereas calcaneus is your heel bone. Okay, so this top view is pretty tough to kind of imagine that. Okay, look at calcaneus here. It is your heel, whereas talus is above it, which is connecting to the ankle. Okay, talus is actually making the ankle joint with tibia and fibula. Okay, so if we looked at it on here, we'll see talus and then calcaneus. There are some other tarsal bones. You don't need to identify them, but just need to know their name. Okay. You can find their names on the lab notes, but the other ones are the medial, intermediate, and lateral how should I do this? Cuneiforms. Okay, those are these ones right here. Medial, intermediate, and lateral cuneiforms. Then you're gonna have cuboid and navicular. Here's cuboid, here's navicular. Don't worry about where they are. Just know that these are their names for like a multiple choice question or something like that. Okay, you can find these on your lab notes too. And then the rest of the foot will be just like the hand actually. Okay, instead of metacarpals, it's going to be metatarsals, and we always name it from the big toe side. So this is 1, 2, 3, 4, 5. Okay. So if I asked you, hey, what is this guy right here? You would say second metatarsal. Okay. Instead of metacarpal. And then we have the same number of phalanges, thankfully. Okay. So how many phalanges are we going to have here?
14.
14, right? So we have 5 metatarsals and 14 phalanges. Okay, look how tiny they are. So we're going to have the proximal row here. Then middle. Then distal.
Would the middles be considered a short bone, or are they still long?
They're actually still considered long. Okay, so if I asked you, hey, what is this bone called? You would say what?
The third middle phalange, or what?
Phalanx, yeah.
Like,
Yeah.
oh, it's phalanx.
Phalanx, yeah, because it's singular, right? When you say phalanges, you're talking about plural. But yeah, you got the idea. And that's it.